Hi everyone, I'm Renée, the CEO of Growing Change, and this is Jess, our Operations Manager, and we're super grateful to be here tonight. Growing Change uses gardening to connect and improve the lives of people that are socially isolated, mentally unwell, and generally in need of a hand. And tonight we're going to share with you the story of Growing Change's inception, 3 stories of people who represent our target participants, and tell you exactly what we will do with $100,000, which is a massive game-changing opportunity for us. The first story is about my mum, Gail. For most of Mum's adult life, she battled depression and anxiety, but things got really bad a couple of years ago when she was in her mid-50s. She was hospitalised on a number of occasions, experiencing chronic mental health episodes, and she tried to take her life several times. She ended up losing her job and was living in a caravan park, really struggling to make ends meet. More than anything else, she was extremely isolated. She didn't really have any friends and no social network, and the mornings were always the worst for her. She'd wake with anxiety, knowing that she'd have a whole day of nothingness ahead of her. She was more than just bored, and she felt her life lacked meaning. In 2010, my mum chose to end her life. I've constantly thought, what if? What if there was a safe and supportive environment that my mum could go to socialise and do something meaningful with her time? What if there was somewhere that supported her on her journey to recovery that wasn't the hospital or the doctors or the chemist? When you lose someone to suicide, there are always so many what-ifs. So I looked to the strengths of my mum and the moments when she was well, and through the ups and downs of dealing with the mental illness and her life falling apart, there was one constant, and it was gardening. More than anything else, gardening was where she found strength. So after undertaking an enormous amount of research, I discovered this thing called horticultural therapy, which is simply gardening for well-being. It's really big in Europe and North America, and it's practiced on farms through a concept known as social farming. So sitting with all of this knowledge of my mum's experience of her battles and the gaps in her care, witnessing them on a very personal level, and knowing where she found strength, also knowing that she's not the only one to experience these issues. Suicide is one of the leading causes of death in this country. I knew that I had to act. And so I started Growing Change. At Growing Change, we use horticultural therapy and social farming to connect with vulnerable people. We find a plot of unused land and we convince the owners to give it to us for 3 or more years. We then recruit a bunch of volunteers who are eager to get their hands dirty, and they help us establish a farm. We invite referrals from partner organisations who work with vulnerable people like my mum, to take part in our 12-week social horticulture program. Our purpose is to connect socially isolated and vulnerable people to each other, to a support network, and to activities that will help them improve their constant poor mental health. And we were looking for a partner who was willing to try this idea with us when we found our first project in Mount Lawley at a men's lodging house. This project was going to be way too much for just myself to handle, and Growing Change needed someone who could just get things done, who was great at gardening, passionate about helping vulnerable people, and could handle themselves around CEOs of big organisations as well as a bunch of semi-homeless blokes, and do it all for next to nothing. It's a pretty unique skill set and a massive ask, and thankfully for me it was at that time that I met Jess.
Thank you. I've been working with Growing Change for a year now and have been managing our Mount Lawley project. I'm going to tell you our second story. It's about my sister Brooke. Her story is my motivation for working with Growing Change. Brooke will be 24 years old next week, and she suffers from a chronic mental illness. For the past 5 years, my family and I have been on a journey with her through the mental health system. All of her treatment has been based around clinical approaches and hospitalisation. Her experience has made her completely terrified of the mental health system. Everything scares the pants off her. Each episode and the following treatment, she gets more scared, isolated and disconnected. From the health service, from society, her family and from me. Over these 5 years, I've become acutely aware of the gaps in mental health services in Fremantle. I know she is desperately lonely and wants to reconnect with society in a place where she can feel valued. I'm involved in Growing Change because I've seen the gap and I've seen the solution in our model. This is Dave. He's the third story. I've been gardening with Dave in Mount Lawley every week for the last 5 months. Dave is 66, has a severe speech impediment, and 15 years ago he lost his wife to pneumonia. Like most of the 17 residents at the lodge, Dave spends most of his time in his small room, limiting his contact with the other guys or the outside world. When I started gardening with Dave, he told me that sometimes he feels so lonely he doesn't eat. This is what Dave and the other guys have created. Since the garden was planted, Dave and other residents have been out there every day. It's become the socialising area, the area that brings people out of their rooms. Even those that don't actively garden are using the space to sit and talk. Dave was so lonely he sometimes didn't eat. Now he's always the first in the garden, waiting for me to arrive. During our lunch breaks, Dave slams down 3 to 4 salad sandwiches at a time. It's not just about gardening for Dave. It's about gaining confidence and feeling valued in his contribution. In a place that is a last resort for men who are seriously down in their luck, Dave takes pride in what we've created together. I think we can all agree there is no shortage of people within Fremantle that are in similar circumstances to Dave or Brooke or Gail. You just have to walk through the middle of town to see it. We want all of those people to have positive stories like Dave's. Our plan is to do this with the Fremantle Social Farm. Tonight, we're asking for your help to transform an unused public space, a bowling green in North Freo. It's been sitting unused for over a decade. We have formal approval from the City of Freo to turn this space into an active social farm, a place that supports people on their journey to recovery. We're almost ready to get growing. We've got land. We've got more than 10 tonnes of compost from Perth Zoo. We have volunteers to set it up. Renée and I are receiving emails and calls on a daily basis from people wanting to get involved. We have customers for our produce. We have established partnerships with referral organisations who have people waiting to join our program, people like Dave.
And what we're missing is the seed funding for critical farm infrastructure to get crops in the ground. With your investment, we will be able to set up the farm and provide 100 placements to vulnerable people in Fremantle in our 12-week social horticulture program. The program includes a set of tools, 12 weeks of intense learning, regular meetings and social events. After the 12 weeks, people have an opportunity. They can establish a micro-business by renting a plot in the garden, and they can continue growing and harvesting produce which we sell through our customer networks. This provides them with an income and employment opportunities and creates something very meaningful in their lives where perhaps there was a whole bunch of nothingness, as my mum experienced. We cater to the needs of our clients, but we're not looking to replace any existing services. In fact, we work collaboratively with them. The Fremantle Social Farm fills a gap between when somebody's crying out for help and before it's too late. It's a bridge between what is and what could be, between a difficult life, a difficult past, and a future of opportunity. The farm connects to the public in an active way through community volunteering, busy bees, gardening workshops, farm open days, and of course through produce sales. And the Fremantle Social Farm is a financially viable and sustainable social enterprise. When we commenced this project, we actively chose to create a really strong business model. We've done the numbers, and the income from crop sales is all we need to sustain our operations in the long term. We've completed financial modelling for 123 different crops, and we've narrowed our list down to our top 10 and our top 3, and these are all based on market demand and profitability. The chefs at Bread and Common, More and More and Strange Company have all signed on to purchase our organic produce at premium prices. We wanted to avoid the endless funding merry-go-round and focus on doing the real work of growing change, supporting those people in need. The Fremantle Social Farm will be it will truly build community spirit, and it will be a legacy that the whole community can be proud of. And that's why the Fremantle Impact100 investment is so important to us, because we see the benefit that we're already having with our programs. Thank you.